Buddhism and mental health, mindfulness-based therapy for anxiety and PTSD patients. In this paper, we will discuss Buddhism as a mental health practice, its relationship with certain modern psychotherapies, and how both can be utilized as therapy for patients suffering from anxiety and PTSD. First, we need to ground ourselves in the origins and fundamental philosophy of Buddhism. The founder of Buddhism, Siddhartha Gautama, was born 563 BC into a wealthy family. This princely life of riches was rejected by him at age 29, and he embraced a lifestyle of asceticism or extreme self-discipline. He sat under a Bodhi tree for 49 consecutive days of meditation. Gautama became the Buddha, or enlightened one. Buddhism is followed by an estimated 500 million to 1 billion followers. Scholars consider Buddhism one of the major world religions as a philosophy or a moral code rather than an organized religion. Many of the belief and practices of Buddhism revolve around suffering and its causes. Buddhism started about 500 years before Christ and preached ways to overcome suffering, dukkha, and the cycle of death and rebirth through nirvana, moksha, or the path to liberation by practicing dharma, righteous deeds, karma, noble deeds, and dan, charity to lesser privileged souls. The core of Buddha's teachings is contained in the Four Noble Truths, which was the Buddha's first teaching following his enlightenment. Number 1, the truth of suffering or discontentedness, dukkha, that in life there is suffering. Number 2, dukkha is caused by the three poisons, samudaya, the attachment, aversion, and ignorance. Number 3, there is a path to liberate and let go of suffering and to end it, nirodha. Number 4, the Eightfold Path is the way to liberate and let go from suffering, magga. This means you have to have the right morals, behaviors, and actions that do not generate negative karma. The Noble Eightfold Path refers to interconnectedness dimensions of a person's behavior, addressing the development and maintenance of wisdom, moral discipline, and concentration of mind, although they describe a complete way of living supporting the goal of liberation. Number 1, right view of nature of mind and the Four Noble Truths. Number 2, right intention, avoiding the three poisons. Number 3, right speech, refrain from lying, divisive, and harsh or senseless speech. Number 4, right action, avoid physical misdeeds like killing, stealing, and sexual misconduct. Right livelihood, avoiding trains that harm people and animals, and avoid intoxicants. Number 6, right effort, abandoning negative states of mind that arise and yet to arise, and sustain positive states that have already arisen. Number 7, right mindfulness, awareness on body, breath, thoughts, emotions, sensations, and anatta, which is the non-self. Number 8, right concentration, one-pointed concentration. The result will be understanding of the Dharma and bring it into your life. Basically, then, the Buddha was the world's first psychotherapist. He identified a mental illness, dukkha, diagnosed the root cause of the illness, samudaya, determined that there is a cure for the illness, nirodha, and wrote out the prescription, ariga magga. Of course, a tradition with the history as long as Buddhism's develops many different concepts and practices. But at its core, Buddhism's goal is the cessation of suffering through cultivating one's understanding of the root of that suffering and developing practices which will further that goal. It presents a body of learnings and a holistic lifestyle system that, if followed, supports attainment of the goal. Since Buddhist psychology revolves around that idea that the primary cause of human problems arise from the human mind and not external conditions, analysis of our own thoughts and behaviors and how they contribute to how we experience life is necessary if we are to truly relieve suffering. Therefore, all the major strands of Buddhism, including Theravada, Mahayana, and Vajrayana, employ various mindfulness practices to develop the practitioner's ability to maintain mental equilibrium and a present momentness. In these practices, we learn to take in each moment as it comes, fully aware of them, but without judging or otherwise interfering with our processing of them. It is through such practices that we develop self-awareness, personal responsibility, and an ability to make skillful choices. Buddhist meditation asks us to focus on the self rather than expend energy on outside sources of issues by using mindfulness to develop the central value of Buddhism. There are 4 core foundations of Buddhism mindful meditation. Mindfulness in the body. What is being perceived by senses in this moment? Mindfulness of our feelings. How do we feel about what we are perceiving? Mindfulness of our minds. What emotional reactions are we experiencing based on what is being perceived? And mindfulness of phenomena. What is the nature of our perception? Buddhist mindful meditation requires that those who practice it are motivated to develop the skills needed to relieve suffering from themselves and from others. Demonstration of such motivation is often as complete an adoption of the lifestyle of the Noble Eightfold Path as possible, specifically the last 2 elements: right mindfulness, awareness of breath, body, thoughts, emotions, sensations, and the anatta, non-self, and right concentration, the one-pointed concentration, the result of which will be understanding of the Dharma and bringing it into your life. Over the past 50 to 60 years, Western psychology has developed several psychotherapeutic methods that incorporate key theories and practices closely associated with those of Buddhism, including the meditation practices of samatha, calmness and concentration, vipassana, mindfulness and insight, metta, compassion and loving kindness, and Zen, dialectics and non-attachment. As with the various Western methods, different Buddhist traditions give more or less weight to these and other practices. Before discussing these Western therapeutic methods in more detail, let's first understand a little more about 2 mental health issues that are common in the modern world: generalized anxiety disorder, GAD, and post-traumatic stress disorder, PTSD. Below is a table summarizing symptoms that can be exhibited by someone experiencing general anxiety disorder. It is fair to say that someone exhibiting these symptoms is suffering, and in the absence of a definite physical cause of these symptoms, it is reasonable to consider that the real cause of the suffering might be found not in the physical world, but in the types of poisonous thought patterns identified by the Buddha: ignorance, attachment, and aversion. General anxiety disorder is characterized by persistent and excessive worry about various aspects of life, possibly without even realizing what the specific trigger for this worry is. Buddhists see this as a stemming from attachment to desired outcomes and aversion to uncertainty or potential negative events. The constant worry reflects a mind that is not at peace with impermanence and change. Post-traumatic stress disorder involves intrusive memories, avoidance behaviors, negative alterations in cognition and mood, and hyperarousal following exposure to traumatic events. While formally associated with soldiers returning from war, we know that all people who have experienced traumatic situations such as sexual abuse or spousal abuse or even childhood bullying can be triggered by a range of stimuli to re-experience the trauma, even and especially when not really in the original situation. Buddhism might view this as the mind clinging to past traumatic experiences and struggling to accept the reality of what occurred, leading to ongoing suffering. Buddhism offers various practices that can help address both general anxiety disorder and post-traumatic stress disorder. These include mindfulness meditation to cultivate present moment awareness and reduce dwelling on past traumas, which can't be changed, or future worries, which may never happen. Loving kindness, metta. Metta meditation to develop self-compassion and reduce self-blame, often associated with anxiety and PTSD. Insight practices to gain a deeper understanding of the impermanent and interdependent nature of all phenomena, potentially reducing attachment to fixed outcomes or identities. Breath awareness and body scan techniques to ground attention in present physical sensations rather than anxious thoughts. And then finally, the contemplation of the Four Noble Truths to understand the nature of suffering and the path to its cessation. Cognitive behavioral therapy, developed by Aaron Beck and Albert Ellis in the 1960s. Cognitive behavioral therapy focuses on identifying faulty or negative thought patterns and behaviors and modifying them. Although developed independently of Buddhism, his approach is very similar, especially to the idea that our thoughts shape our reality, suggesting that the self is an illusion shaped by thoughts and perceptions, many of which may be flawed. Cognitive behavioral therapy is particularly used to help one become aware of their inaccurate or negative thoughts, providing the space to view challenging situations more clearly and respond to them more efficiently, rather than reacting reflexively in a conditioned manner. It has proven useful in helping people address a wide range of psychological problems such as depression, anxiety, phobias, obsessive compulsive disorder, and PTSD. Substance abuse disorders, bipolar disorders as well. However, it should be noted that mindfulness in cognitive behavioral therapy is somewhat different than that in Buddhist practice, and that it is used to identify and address negative thought patterns rather than simply observing thoughts without attachment or judgment, as in Buddhist practice. John Kabat-Zinn, PhD in molecular biology at MIT, studied meditation with Zen masters, and in 1979 he developed an 8-week mindfulness-based stress reduction, or MBSR program, initially for stress management. Eventually, MBSR evolved to offer mindfulness training to help people not only with stress, but also to treat anxiety, depression, skin diseases, hypertension, diabetes, immune disorders, and pain as non-pharmacological treatment for chronic illnesses. Mindfulness-based stress reduction can be considered a secularization of Buddhist meditative practices, including samatha and vipassana. It emphasizes mindfulness, focusing on present moment awareness and non-judgmental observation. The practices taught include sitting meditation, body scanning, mindful movement, and other similar tools. Several research studies have supported MBSR in the treatment of both general anxiety disorder and PTSD. For example, a 2022 study compared MBSR to an antidepressant for treatment of anxiety disorders and found that the participants in the 8-week MBSR program gained the same amount of symptom reduction as the drug group. There have also been studies supporting the use of MBSR for PTSD. Mindfulness-based cognitive therapy was developed as an outgrowth and combination of cognitive behavioral therapy and mindfulness-based stress reduction, primarily to provide individuals with major depressive disorder needed resources to prevent relapses. But studies have found the therapy to also have positive effects for addressing general anxiety disorder. Like in BSR, MBCT is heavily influenced by Buddhist mindfulness practices, incorporating meditation techniques to foster awareness and acceptance of thoughts and emotions. Reflecting Buddhist principles of mindfulness and impermanence. The combination of CBT to identify the negative thought patterns can trigger a major depressive episode with mindfulness practices. To help the individual separate themselves from their thoughts has proven to be an effective and maintenance antidepressant treatment for maintaining a quality of life, preventing depressive relapse over a 24-month period. Scientific investigations have revealed information about the biological mechanisms of meditation. According to the EOC Institute, meditation affects the levels of several chemicals in the body and brain, resulting in improved mental and physical effects. The EOC Institute, some of these are listed below. Serotonin, increased levels to a happier state of mind and improved mood. Cortisol, reduced levels led to reduced stress and less physical wear and tear. DHEA, increased levels may lead to increased longevity. GABA, increased levels help calm and ease anxiety. Endorphins, increased levels reduce pain and cause euphoria. Growth hormone, increased levels are anti-aging, and melatonin, increased levels help sleep. Finally, it is a sad commentary on the modern healthcare system that ultimate validation of the effectiveness of any therapy is whether an insurance company will reimburse treatment expenses. While it is doubtful that any insurer will reimburse a Buddhist teacher for guiding someone through the Dharma or learning mindfulness meditation, all the foregoing secularized therapeutic methods may be considered medically necessary for treatment of various psychological problems such as generalized anxiety disorder, major depression, adjustment disorders, and borderline personality disorder, among others. Valid CPT codes include 90832, 90834, 90837, and 90838, depending on the amount of time per therapy session and whether EM service is included. These CPT codes are the treatment of individuals, and there are other codes for families and groups. And finally, cautions and contraindications. Reported side effects of meditation. Scientists have been studying meditation and understand there is a cascading effect of dopamine, noradrenaline, adrenaline, endorphins, and serotonin in the brain and body. Meditation is not a one-size-fits-all. Different personality, body, and energy types do better with specific types of meditation training. For example, in Ayurvedic medicine, the three doshas, the wind-type patients need calm abiding meditations. The bile-type patients need more analytical or visualization meditations. And phlegm-type patients need to get up and move more with physical activity type meditations, yoga, tai chi, or dance. People with a history of mental illness or family history of mental illness, meditation can set off a psychosis lasting for years. Meditation may release emotions and mental blockages from abuse and trauma, causing unprocessed anxiety, grief, or anger. There are reports of studies where sobbing, release of hidden memories, and themes from the past like incest, rejections, and abandonments may be experienced. Uncomfortable kinesthetic sensations are reported along with mild dissociation, guilt, psychosis, grandiosity, elation, destructive behavior, even suicidal thoughts were found. As many as 62.9% in a study done were found to have adverse effects from meditation. They range from anxiety and panic attacks to increase in tension or confusion, feeling less motivated in life, boredom, pain, feeling spaced out, an increase in negativity, and even feeling addicted to meditation. All doctors agree meditation has benefits, both positive and negative side effects, but it is best to have a long-time teacher skilled in meditation. And here's our references page.